Have you ever wondered if there's a deeper connection between your mind, body, and diseases? This is where German New Medicine steps in. German New Medicine, or GNM for short, is an alternative approach to understanding the causes of diseases. It suggests that our psychological state, how we feel and think, has a powerful impact on our physical health. This idea, while intriguing, is not without controversy. GNM challenges the traditional medical paradigm, which primarily focuses on physical symptoms and their treatment. Instead, GNM proposes that by understanding our mind's influence on the body, we can unlock new ways to heal and stay healthy. This mind-body disease connection is the cornerstone of GNM, and it's what sets it apart from other medical practices. Now, let's dive into the 5 biological laws of German New Medicine that explain this mind-body disease connection. Let's start with the first biological law of GNM, also known as the iron rule of cancer. This rule is truly fascinating, as it suggests that a disease, such as cancer, originates not from some random mutation or malfunction, but from an unexpected shock or trauma that catches us off guard. Imagine it, a significant, distressing event that we experience could set off biological changes in our bodies. Now, what's even more intriguing is that this law views disease not as a mistake or failure of the body, but as a survival mechanism. Yes, you heard it right. It proposes that our bodies respond to these unexpected shocks with a biological program that's designed to protect us, not harm us. It's a radically different perspective, isn't it? We've always been taught to see disease as something going wrong in our bodies, but this law suggests it might be our body's way of trying to right a wrong. This law challenges the conventional understanding of disease, doesn't it? Moving on, the second biological law of German New Medicine is about the two-phase nature of diseases. This law proposes that diseases are not static but dynamic, transitioning between a conflict-active phase and a healing phase. In the conflict-active phase, the body reacts to a stressful event, a conflict shock, and the symptoms we experience are the body's response to this conflict. On the other hand, the healing phase begins when the conflict is resolved, and the body starts to repair and restore itself. This dance between conflict and resolution, between disease and healing, is a fascinating aspect of our biology. The second law gives us a new perspective on disease progression and healing, doesn't it? The third biological law of GNM explains the brain's role in diseases and delves into the enthralling realm of neurobiology. This law proposes that our brain is not merely a passive receiver of information, but actively partakes when a traumatic event transpires. The brain absorbs the shock of the traumatic event and conveys the necessity for adaptation to the body. Acting as a command center, it orchestrates the body's response to help manage stress. This law presents an intriguing concept of brain-body communication, which is quite captivating. Lastly, let's talk about the fourth and fifth biological laws of German New Medicine. The fourth law, also known as the ontogenetic system of tumors and cancer-equivalent diseases, suggests that diseases are not random misfortunes but meaningful biological programs. It proposes that our bodies generate symptoms in response to unexpected psychological conflicts, working to restore our normal physiological state. Now, moving on to the fifth law, the quintessence. This law encourages us to understand disease not as an error, but as a part of our evolution. It implies that every so-called disease has to be comprehended as a meaningful, special biological program of nature created to solve an unexpected biological conflict. These last two laws invite us to see diseases not as enemies, but as part of our survival and evolution. So we've explored the 5 biological laws of German New Medicine. What a journey, right? Let's summarize. The first biological law tells us that disease is not an error, but a meaningful biological program initiated by a significant psychological shock. It's a survival mechanism, if you will. Moving on to the second biological law, it emphasizes that every disease process is composed of 2 phases, provided there is resolution of the conflict that triggered it. It's not a one-and-done deal, it's a process, a cycle. The third biological law, on the other hand, introduces us to the concept of the organ-brain connection, highlighting the fact that the brain is the mediator between the psyche and the body. It's the control center, the bridge that connects our psychological state to our physical state. Lastly, The fourth and fifth biological laws bring us the understanding that diseases aren't senseless disorders, but meaningful biological programs. These laws challenge us to look at diseases not as enemies to be fought, but as expressions of our body's attempt to survive. German New Medicine surely brings a new perspective to our understanding of diseases, challenging us to think beyond the conventional medical paradigm.